season and everybody is raising their guidance.
So long as you're talking about the two digital health companies that are public and not the rest of the economy, which is cratering.
Well, it's not my fault that the rest of the digital health companies didn't go public. It's the May 7th edition of Health in 2.00. Holtz, I know you are dying to talk to me about that Livongo earnings report. We have dissected the email, but you cannot say a word until you go through this 2-minute of Q&A about the deals that have happened this week with me.
Can I say a word about the other deals? No.
No words, just deals. Set that timer. Let's go.
Okay.
Enough with the small talk. All right, we're ready? It's not going. All right, hit it. There we go. All right, let's get checked. Get 71 million at-home testing. The boom is here.
Yeah, a bit strange because it was all about COVID testing. I'm not sure they do one. Everlywell, which has got a really interesting article in Inc. about Julia Cheek there, trying to figure out whether the FDA would let her do at-home testing or not. There are a couple of other people who are talking about at-home testing, but right now not much of it. So a large amount of money for Let's Get Checked on the testing, on the home testing front. It's probably a good idea. There will be more home testing rather than just pregnancy tests and bowel tests, which have been bowel cancer tests, been what they've been so far. But it sounds like a lot of money.
Okay, how about 25 million for Vida Health? What do you think about that one?
That's interesting. So Vida Health, yeah, Stephanie Telenius has been running this for a while. They started out being a coaching platform pretty similar to Ramada and Livongo, but they did everything all at once. It's always been a nice platform. They've always kind of been the bridesmaid, not the bride in that sector. Those big companies are probably coming after them. They have an investment with Teladoc. Teladoc didn't buy them all. They're not in this round. Maybe.
Okay. What about Medable? 25 million there to speed up clinical trials.
Taken a while, but well-known Michelle Longmire, who I've known for a while in this space. This is a really cool sort of app where you, as an investigator or a drug company working with them, can build your own clinical trial, get around a lot of the sort of the headaches of using enterprise software to do that. It's pretty clever. I have been talking about it for a while. I like this. It's glad they finally got a big round. Hopefully they'll blow it out and do well with those pharma companies and speed time to market.
How about Burnalong? They get 4 million for virtual corporate wellness because this is a great time to invest in that.
What the hell is that?
Exactly. I don't know.
No,
and tell me.
It is because, corporate wellness and stuff. And
they're a virtual streaming platform for yoga classes and things like that they're going to sell.
I suspect the burn will be high.
Okay, speaking of burning, Livongo!
What happened to Livongo?
I knew it was coming.
Let's go on. What happened to Livongo?
Feel the energy of that timer about to go off. Livongo releases their Q1 earnings report today, and we've picked through this email with all of the statistics. Mr. Holt, what did you find to be the most compelling part of setting?
Well, I thought it was a miracle that they had, not a miracle, I thought it was amazing that they had flouted all the laws of Silicon Valley by actually claiming to have a net positive EBITDA for the quarter, even though they're not claiming to have one for the year coming up. But apparently they actually had one last quarter as well. But I think the other interesting thing is that the stock went up basically 10% yesterday, 10% today in advance of these earnings. They still beat the market, and the last I saw after hours, the stock was up even more. Mm-hmm. So it went from like the low 20s, even the high teens when the sort of crash happened. And they were back there in sort of October. Now it's hitting on the way to 50. I cannot wait till I see a certain CFO who may have bought a company or two before in his time, Mr. Shapiro, get his checkbook out and go around and buy some stuff. I wonder what Glenn Tillman and Dave Burke will let him do. But
what do you think? Any guesses?
Oh, there's...
What are they missing?
Asthma, respiratory, musculoskeletal, blah, blah, blah. There's a whole list of stuff. If they want to become the one, and also acute care stuff, more sort of respiratory monitoring and the stuff for COVID, they've been denying that for days and days and weeks now, but I think that's they've got to be thinking about it all. And with a stock price like that, the only people who can outbid them in the space are Teladoc, whose stock is even crazier. Unless Zoom, of course, becomes a digital health company, even though they're...
Oh, I don't know.
Maybe they are. Maybe they're not. Who the hell knows? But their stock's crazy as well. So between those two and Amazon, There's a lot of potential acquisitions happening out there, which I think we'll see more of.
Oh, can I ask you a quick follow-up? So I heard, just in a casual conversation, I know, because, you're going to silence me. Damn it.
Oh, there's no silencing Jessica here.
Oh, my God. It's the post-COVID era. I don't get silenced.
We're now just casually chatting.
I would like to hear your thoughts on this. I was having a conversation with somebody, and they were saying that really the only way that some of these digital health companies are going to scale is if they are bought out by, or like a virtual care company like Teladoc, if they're really going to become ubiquitous. The only way for them to do that is to get bought by like one of the big like retail companies, like either like an Amazon or a Walmart or CVS Health. What do you think about that?
Well, I mean, that's been a conversation for a long time. I think that is the way it could happen. I don't see much appetite from the big tech giants, maybe with the exception of the two you mentioned, but possibly Amazon, to actually scale an entire healthcare practice. You've got to put together chronic care management, which is kind of the Livongo thing. But, I just said Livongo, which is the biggest in that space, hasn't added a bunch of other things in that space, and it still only has 320,000 people on their diabetes platform when there are, 35 million with diabetes. So it's a long, long way to go for them to get big. Then you've got to think about managing day-to-day, acute care for the healthy, which is a Teladoc sort of American well thing. Then you've got to think about doing what happens in the hospital, outside of the hospital, which is all that remote monitoring and, management of the acutely ill, that people with COVID. And then you've got to think about how do you manage and integrate into that overall primary care and specialty care, which is kind of where you've got people like Iora Health and Village MD and CAMO and all those people doing sort of primary care stuff. And then there's all the stuff that real healthcare systems like Sutter and Kaiser and Providence are doing in the specialty care realm, where they make all their money or not making their money at the moment. So it's a very complex ad for all these people to do this. So yes, that's how these individual digital health companies would scale. I don't yet see a massive appetite from the big tech vendors, the retail players, to add all the stuff they need to do. You are seeing a bit more acquisitions from the incumbents. Optum's doing stuff. Even Blue Shield bought a medical group. So yeah, you're going to start something behind it. And the real question I think that everyone's going to ask, and this is what we talk about like at length on THCB Gang, 4 p.m. Eastern, 1 p.m. Pacific every Thursday.
God, did you just shamelessly promote your other show in the middle of my show with you? How dare you?
Okay, you run it last week and you're rather good. What we're talking about is, does the payment system change enough that typical doctors and hospitals are not managing their finances based purely on fee-for-service, quote-unquote, elective visits that have been delayed due to COVID? And that's got to change to some sort of mega thing where we're now paying them for maintenance care of the chronically ill and the acutely under COVID. And that's got to be a big policy decision, which isn't happening yet. Having said that, it's clearly got to go in that direction, because we can't have a situation that we had this month or last quarter where a whole half of the collapse in the economy is reduction in healthcare spending when you've got a healthcare crisis. That makes no sense.
No.
All right, rant over. What were
I
you asking?
like it. I love like getting that bonus 2 minutes of ranting from you.
I know, the poor
Every once in a while, I'm in the mood.
Off by now.
What?
The poor people watching this would have turned it off by now.
Well, oh my God, they turned it off a long time ago, please.
So we're just talking to each other now. Well, given we're talking to each other, should we just stop?
Yeah, we should just stop. So if you want to hear more from Matthew Holt, the show that he was shamelessly promoting a few seconds ago is the THCB Gang, and that is on the healthcare blog, and it's live. That's a fun one. It's a big panel of people, lots of the contributors from THCB. You guys should definitely check that out. It is on at 1 p.m. Pacific, so 4 p.m. Eastern on the Healthcare Blog's website, so you can tune in there.
On Thursday.
On Thursday, I should say. I'm sorry.
It's a podcast later. You can find it the same way.
You find that on Spotify and iTunes, yeah, along with our show. We're a podcast too, don't forget. So when you do start going back to work, you can take us with you. I'm Jessica DeMassa. That's Matthew Holt. Follow along with us on Twitter at Jess DeMassa, at BoltyBoy, and we'll talk to you guys real soon. Thanks so much.